And welcome back to the show. According to the United States Department of Health and Human Services, only about 12% of the population has good health literacy. Now, this means about 88% of adults may lack the skills to manage their health and reduce their risk of disease. Taking care of our health is part of everyday life, not just when we visit the doctor, the clinic, or a hospital, but health literacy can help us prevent health problems and protect our health, as well as better manage those problems and unexpected situations that may happen. And joining us now to share more details is the attending neurologist at Montefiore Medical Center and assistant professor at Neurology at Albert Einstein College of Medicine, Kathryn F. Kirchoff. And we thank you, Kathryn, for joining us.
Thank you. It's a pleasure to be here today.
You know, when we have the conversation about health literacy, I think sometimes the definition goes astray. So let's first educate our viewers a little bit on health literacy and how it actually affects each and every one of us.
Yeah, so my goal today is to help people to learn better how to navigate the health system. So as we know, things have become increasingly complex with electronic medical records and with virtual visits now, especially during the time of COVID, as well as how to interface with the pharmacy and with multiple specialists as well as primary care. So I think it's very important for people to be facile in how to manage and navigate their own health.
Yeah. Why is it such an issue for us to be able to be health literate, if you will? Because when it comes to the fact of going to doctors, many of us go to doctors, we have visits, we know these things, but when it comes to health literacy, sometimes we just fall short.
Yes, well, I think it's something that they really don't teach in school. I really think it's and I think it's so critical for people to learn this, because I believe that knowing how to navigate health will help people have better outcomes and hopefully prevent the long-term sequelae of chronic medical conditions such as hypertension and diabetes, if they can advocate for themselves earlier on in the course of the disease to have consistent care and that long-term follow-up.
Yeah. And so as you're walking people through this and helping people become more literate, what is it that they should know?
Well, I think the first thing that's important is while you're well, that's the time to establish care with a primary care doctor. You don't want to wait until you become sick to find a primary care doctor, because it really starts with prevention. So if you have a primary care doctor, you can start doing yearly physicals to be screened for conditions such as hypertension, diabetes, sleep apnea, in order to get started on treatment early to prevent complications such as heart disease and stroke. You can also discuss with your doctor your family history of things such as coronary artery disease and cancer, so that you can start the general age-appropriate cancer screening, such as mammograms at age 40 and colon cancer screening at age 45, for example. And you can also talk about your particular own personal health risks, and they may tailor your screening to your own family or personal medical history.
A lot of times we deal with prescription medications, and we know that that can be a challenge. Just keeping up with them, knowing the names of them, knowing when to administer them, refills, the whole 9 yards. That can be a huge mountain for so many people, and especially if you're just entering into the fact of having prescriptions. Talk to us a little bit about prescription medications and how to navigate that.
It can be a real challenge to manage prescription medications. So many medications sound the same or have two names. In my particular specialty, I care for stroke patients, and sometimes there may be issues with vision impairment and reading and language after a stroke. And so reading a pill bottle can be a real challenge. So I think there's a few important steps initially to take. So familiarizing yourself with how to read a pill bottle label. I think take a moment to look at your pill bottles, and you'll see that there's the pharmacy name on the top, the prescribing doctor, the medication with the instructions about how to take the medication, and whether or not there are refills left. So if you see that it's time for you to get a refill, meaning it may say 0 refills left or no refills remaining, you would want to make sure that you're calling the doctor who originally prescribed the medication, and that you're specifying which pharmacy you would like them to send it to. Oftentimes people ask us for a refill and we put the refill through the computer, but the computer may default to pharmacy that was used previously. It may not be the one that the patient is actually planning to go and pick up the medications from. So there may be a disconnect as the medication may not be available when they go to the pharmacy. So understanding when it's time to just call your pharmacy if you have refills remaining, or when it's time to actually call your physician because there are no more refills remaining and they need to rewrite the prescription is an important thing to understand.
Yeah. So, Kathryn, what do we do now for a person that's watching right now saying, listen, I need help. This is all new to me. I really want to try to learn how to navigate this. What do I do?
Well, I think asking questions is a good place to start. So that's why having that, primary care physician is there. A big question people have right now, of course, is whether, they can receive vaccinations. And of course, talking about COVID vaccinations is a big issue right now, but there are other important vaccinations that adults should have depending on their age, such as the pneumonia vaccination, the shingles vaccination. So asking those questions when you're going for your physical, and I think that's very helpful. I think it's important to understand that while your doctor may have an electronic medical record, it may not communicate with other of your medical care team's electronic medical records. For example, if they're in a different practice or at a different institution. So asking for your medication list to be printed, carrying your medication bottles to each visit can be helpful to clarify any discrepancies. Asking for any important lab results or records to be printed for you so that you can carry them to the other physicians that you receive care from in order to make sure everybody's in the loop. And we don't want to depend on the computer if it may not be communicating between doctors.
Yeah. And so when I think about this, I think about myself and I say, wow, I remember when I was first introduced in the patient portal, and I was like, oh my God, more, I got to do this, really? But I did find it to be very helpful at the end. But I want to go back to my original thought of, oh my God, I got to do this, patient portal, and the many other people who look at it and kind of like ignore it or say, this can wait. Give some people some encouragement or some advice as to tell them why something as simple as a patient portal might be very, very advantageous to them.
Yes, it's a great point. So I've been practicing here at Montefiore in the Bronx for 11 years now, and I've been really impressed with how well our patients here have accepted the portal and have started to use the portal to communicate during COVID. It's very helpful for patients because they can send a message sort of like an email through the portal to reach us directly rather than having to go through a phone tree, which I think is a huge benefit. They can request refills electronically. They can access their own records and their own lab results so they can communicate those to their other parts of their medical team. So I think there's a lot of benefits. It is a little bit of a hurdle for people who may not have been very familiar with computers beforehand, but if you can use an email or operate a smartphone, I think most people do very well. We also encourage our patients here, who are mostly elderly, to enlist a grandchild or a neighbor who's young and technically savvy to help.
And so enlisting that help, enlisting a young person can actually be quite advantageous. What do you find to be some of the biggest challenges that we have for people wanting to become more health literate?
I think that right now we're dealing with a time period where people don't know exactly how to interpret the large amount of information that's out there on the internet. How do you, decipher quality information from information that may be false? And I think that's where having a trusted primary care doctor can be helpful. Also, using websites of trusted institutions such as hospitals, academic institutions, journals that are peer reviewed. So making sure that you're getting your information from reputable sources, asking questions. I always encourage patients to not wait until the next visit if they have a question, but to call and ask. For example, sometimes patients may experience a side effect of a medication, or a medication may be too expensive. And it's always best to sort of call and ask and before stopping the medication on your own, because sometimes we can help and provide some more information or provide an alternative. So just keep asking questions, keep the lines of communication open with your doctor, and try to seek out those reliable sources if you're looking for information on the internet.
Yeah. What questions are you getting the most these days, given the fact that we're in the midst of this pandemic? I'm sure there's a pretty common threshold of questions that you get.
I think the main questions are revolving around vaccinations and the significant benefits in reducing the risk for serious illness and hospitalization. A question I wish people would ask more often is, as we mentioned earlier, what are my age appropriate cancer screenings? Now, we have a lot of urgent care centers and clinics around the area, and they're increasing in number. And they're a good alternative for when your doctor's office is closed or you have an illness, off hours, or you can't be fit in for the day. But we don't want to rely on them for our ongoing care because those sort of more longitudinal health maintenance issues may not be addressed. So kind of, ensuring that you are not losing sight of the important preventative care while we're in the midst of this pandemic, I think is very important.
Yeah. And so for people who really want to get more information and get dialed into how, like, we need a tutorial, we need to learn how to navigate this, what can they do?
Okay, well, I think first step would be when you see your doctor next time, they usually will give you some information, a tutorial that they print out about how to log on to the portal. I think that's the first step. You can, try to send a message through to your doctor if you have a question. Just basically, you can ask your pharmacist as well. Pharmacists are wonderful resources. You can ask them to explain to you what they're seeing on the pill bottle and kind of the process of when they should contact the pharmacist versus the physician. And I wanted to add one other important point, because we do see this, people get sick unexpectedly, and sometimes we may need to speak with a family member or a healthcare proxy for the patient. So I think it's a good idea now, while you're well, to figure out who your next of kin would be, who would speak on your behalf, ensure that, that's been established. And if it's somebody other than, for example, if your spouse would legally be a next of kin for you, but if you prefer to have someone else be your healthcare proxy, you would want to appoint that. And that's something that you can do as well during a routine visit. You can always appoint a healthcare proxy and talk with your doctor about sort of your overall goals of care in the instance of illness. So I think having those conversations when you're well is a good way to get started on your health literacy, so that you're not in an emergency situation when you become ill.
Well, thank you, Kathryn. A lot of information to be able to digest, and hopefully people will become more active in their day-to-day health. I want to tell you, we've been talking to Kathryn Kirchoff, who is the attending neurologist at Montefiore Medical Center and assistant professor of neurology at the Albert Einstein College of Medicine. Now, for more information, we encourage you to go to the website at montefiore.org. Stay with us. We got more show coming up. Open continues right after this.